what you see here is the lateral view of the hindbrain. You have the brainstem in front and cerebellum behind. The brainstem has three parts. Above is the midbrain, in between is the pons, and below is the medulla, which continues down as the spinal cord. Now, let us review the blood supply out to the brainstem. There are two vertebral arteries which is cruising through the foramen transversorium of the cervical vertebra and entering through the foramen magnum from both sides from behind and goes in front to join and form the basilar artery. The basilar artery goes all the way up to the midbrain, and then it divides into two end branches, that is the posterior cerebral arteries, and it goes further to complete the circle of Willis. Now let us see the branches of the vertebral and basilar artery. Now from here you can see the vertebral artery is apparently posterior inferior to the basilar artery, correct? So the basilar artery is anterior, the vertebral artery is posterior. So now first of all let us see the branches to the cerebellum. You can see a direct branch from the basilar artery to the superior part of the cerebellum like this. So as basilar artery is superior, so superior branch that goes directly to the cerebellum as the superior cerebellar branch. Now let us look at the inferior branch to the cerebellum. There are two inferior branches of cerebellum. The anterior branch, that is anterior inferior branch, will arise from the basilar artery because basilar artery is anterior. And posterior inferior cerebellar artery, or known as the PICA, P-I-C-A, the posterior inferior cerebellar artery, arises from the posteriorly located vertebral artery and goes around the cerebellum, as well as it will cruise laterally around the medulla. So a lesion in the posterior inferior cerebellar artery, or PICA, will lead to lateral medullary syndrome. Thank you.